Imagine being a parent and noticing more hair on your child's pillow, comb, or shower drain than ever before. It's alarming, confusing, and honestly, a little scary. Hair loss in children isn't talked about much, yet it's more common than most parents realize. Today, I want to walk you through pediatric hair loss, especially how zinc plays a role, and most importantly, how to use zinc safely for children. Let me say this clearly from the start. Hair loss in kids is very different from hair loss in adults. Children's bodies are still growing, their hormones are different, and their nutritional needs are unique. So what works for adults does not automatically work for kids, and that's where many parents accidentally go wrong. One of the most overlooked nutrients when it comes to childhood hair loss is zinc. Zinc is not just a hair mineral, it's essential for growth, immune function, wound healing, and proper cell division. Hair follicles are some of the fastest growing cells in the body, so when zinc is low, hair is often one of the first things affected. In children, zinc deficiency can show up as thinning hair, excessive shedding, slow hair growth, brittle hair, or even patchy hair loss. You may also notice other signs like frequent infections, poor appetite, slow wound healing, white spots on nails, or skin rashes. Hair loss is often just one piece of a bigger picture. Now, here's something very important. Pediatric hair loss is rarely caused by just one thing. It's usually a combination of nutrition, stress, illness, gut health, and sometimes genetics. Zinc doesn't magically fix everything, but when zinc is low, correcting it can make a dramatic difference. Let's talk about safety because this is where parents must be careful. Zinc is essential, but more is not better, especially for children. Excess zinc can interfere with copper absorption, suppress immune balance, and cause stomach upset. The goal is correction, not mega dosing. For children, zinc should always be age appropriate. Toddlers, school-age kids, and teenagers all have different needs. Many children don't need supplements at all if their diet is corrected. Food should always be the first strategy whenever possible. The best natural sources of zinc for children include eggs, grass-fed meat, chicken, fish, pumpkin seeds, sesame seeds, lentils, chickpeas, yogurt, and cheese. Even small improvements in diet can significantly improve zinc status over time. For picky eaters, rotating foods and preparing them in kid-friendly ways makes a huge difference. If supplementation is necessary, gentle forms of zinc are best. Zinc gluconate and zinc citrate are commonly used and generally well tolerated for children when given in proper doses. Zinc oxide, on the other hand, is poorly absorbed and not ideal, especially for kids. Absorption matters more than the number on the label. Another key factor parents often miss is timing. Zinc should not be given on an empty stomach if a child is sensitive, as it can cause nausea. Giving it with food improves tolerance. Also, zinc should not be taken at the same time as iron or calcium supplements because they compete for absorption. Now let's address a common fear. Parents often worry that hair loss means something serious. In most pediatric cases, hair loss related to zinc deficiency is reversible. Once zinc levels normalize, hair follicles can re-enter their growth phase. Hair regrowth is slow, so patience is essential. You're looking at weeks to months, not days. Stress also plays a surprisingly large role in childhood hair loss. School pressure, emotional changes, illness, or even major routine changes can push hair follicles into a resting phase. Zinc supports stress response and immune resilience, which indirectly supports healthier hair cycles. Gut health is another major piece of the puzzle. If a child has frequent digestive issues, food sensitivities, or recurrent antibiotics, zinc absorption may be impaired. In these cases, even a good diet may not be enough until the gut heals. Supporting digestion often improves hair growth without increasing zinc dosage. Parents should also understand that not all hair loss in children is nutritional. Conditions like alopecia areata, fungal scalp infections, or mechanical hair pulling require medical evaluation. Zinc can support overall health, but it's not a substitute for proper diagnosis. So here's the takeaway. Zinc is essential for healthy hair growth in children, but it must be used thoughtfully, gently, and safely. Start with food, pay attention to absorption, avoid excessive dosing, and always look at the child as a whole, not just the hair. Hair loss in children can be emotionally tough for parents, but the good news is that kids' bodies are incredibly resilient. When you correct the underlying issue, whether it's zinc deficiency, diet imbalance, or stress, the body often knows exactly how to heal itself. If this information helped you understand pediatric hair loss in a clearer, calmer way, make sure to support the channel. And remember, when it comes to children's health, slow, steady, and safe always wins. When we talk about hair loss in children, one of the biggest mistakes people make is assuming it's rare or purely genetic. In reality, one of the most common and overlooked causes of pediatric hair loss is zinc deficiency. This doesn't mean every child with hair loss is deficient, but it does mean zinc deserves serious attention, especially because children's bodies use zinc at a much faster rate than adults. Zinc is involved in more than 300 enzymatic reactions in the body. For a growing child, zinc is essential for normal growth, immune development, brain function, skin repair, and hormone balance. Hair follicles are among the most rapidly dividing cells in the body. Because zinc plays a key role in cell division and protein synthesis, even a mild deficiency can disrupt the hair growth cycle. In children, hair growth is very sensitive to nutritional gaps. Unlike adults, kids don't have large nutrient reserves. If zinc intake drops or absorption is impaired, the body immediately prioritizes survival functions like immunity and growth of vital organs. Hair growth becomes non-essential, so the body diverts zinc away from hair follicles. This is why hair shedding can be an early and visible sign of zinc deficiency in kids. One reason zinc deficiency is so commonly overlooked is that the symptoms are subtle at first. A child may not look sick. They may still be active and playful. Parents might notice slightly thinner hair, slower hair growth, or more hair left behind on pillows, brushes, or clothing. These signs are often dismissed as normal shedding or blamed on shampoo, weather, or stress, while the underlying deficiency continues. Another challenge is that zinc deficiency doesn't always come from a lack of food. Many children consume enough calories but not enough nutrients. Modern diets are often high in refined carbohydrates, sugary snacks, processed foods, and seed oils, all of which are low in zinc. Even children who eat regularly may not be getting zinc-dense foods. Picky eating makes this even more common. Many kids avoid meat, eggs, seafood, seeds, and legumes, which are primary sources of zinc. If a child mainly eats bread, pasta, cereal, snacks, and sweets, zinc intake can be extremely low even if calorie intake is high. Absorption is another major factor. Zinc absorption depends heavily on gut health. Children who have frequent diarrhea, constipation, bloating, food intolerances, or a history of repeated antibiotic use may not absorb zinc properly. Even if zinc is present in the diet, it may pass through the digestive system without being utilized. This is why some children show deficiency signs despite eating reasonably well. Phytates also play a role. Phytates are compounds found in grains, legumes, and some seeds that bind to zinc and prevent absorption. Diets high in refined grains and cereals, especially when not balanced with animal-based zinc sources, increase the risk of deficiency. This is particularly relevant for children whose diets rely heavily on bread, rice, and fortified cereals. Zinc deficiency in children often shows up in clusters of symptoms, not just hair loss. Parents may notice frequent colds, slow healing of cuts or scrapes, poor appetite, changes in taste, dry or irritated skin, rashes around the mouth, white spots on fingernails, or behavioral changes like irritability or poor focus. Hair loss is often just the most visible sign. When it comes to hair specifically, zinc plays a critical role in the hair growth cycle. Hair grows in phases. There is a growth phase, a resting phase, and a shedding phase. Zinc supports the growth phase by enabling proper protein production and follicle cell activity. When zinc is low, hair follicles can prematurely enter the resting phase, leading to increased shedding weeks or months later. This delayed effect is why parents are often confused. The hair loss doesn't happen immediately when zinc intake drops. It happens later, making it difficult to connect the cause and effect. A child may have had a poor diet, illness, or digestive issue months earlier, and only now is the hair loss becoming noticeable. Another reason zinc deficiency is overlooked is that standard blood tests are not always reliable. Most zinc is stored inside cells, not in the bloodstream. A child can have normal blood zinc levels and still be functionally deficient at the tissue level. This means doctors may rule out zinc deficiency based on lab results alone, even when clinical signs suggest otherwise. Stress also increases zinc demand. Emotional stress, school pressure, lack of sleep, illness, or even rapid growth spurts increase zinc requirements. Children going through growth phases use zinc faster than adults. During these times, even a marginal intake can quickly become inadequate. Infections further deplete zinc. Zinc is heavily used by the immune system. If a child has frequent infections, recurring colds, or chronic inflammation, zinc stores can be drained. The immune system takes priority, leaving hair follicles undernourished. Skin and scalp health are also directly tied to zinc. Zinc helps regulate oil glands, supports scalp barrier function, and reduces inflammation. In zinc deficiency, the scalp may become dry, irritated, or flaky. This creates an unhealthy environment for hair growth and further contributes to shedding in more pronounced cases. Zinc deficiency can lead to patchy hair loss. This can be mistaken for other conditions, creating anxiety for parents. While not all patchy hair loss is due to zinc deficiency, correcting zinc status has been shown to improve hair regrowth in many children when deficiency is present. One of the most encouraging aspects of zinc-related hair loss in children is reversibility. Children's hair follicles are highly responsive. NCE, the deficiency is corrected. When zinc levels are restored through diet or safe supplementation, hair follicles can re-enter the growth phase. New hair growth may appear as fine, soft hairs at first, gradually thickening over time. However, patience is essential. Hair growth is slow by nature. Parents should not expect overnight results. The goal is to support the body consistently and allow natural regeneration to occur. It's also important to understand that zinc deficiency rarely exists in isolation. It often occurs alongside deficiencies in iron, protein, vitamin A, or essential fatty acids. Addressing zinc alone without improving overall nutrition may lead to limited results. A balanced approach always works better. Parents sometimes panic and rush to high-dose supplements thinking more zinc will speed up hair regrowth. This is not only unnecessary but potentially harmful. Excess zinc can disrupt copper balance and immune function. The real issue is adequacy, not excess. Awareness is the first step. Once parents understand that zinc deficiency is a common and overlooked contributor to pediatric hair loss, they can take calm, informed action. This includes improving dietary quality, supporting gut health, reducing processed foods, and using supplements only when appropriate and age-specific. Hair loss in children is emotionally challenging, but it's also a powerful signal from the body. When you listen to that signal and correct the underlying nutritional imbalance, NCE, especially zinc deficiency, the body often responds remarkably well. Understanding zinc deficiency gives parents clarity and confidence. Instead of fear and confusion, there is a logical explanation and a safe path forward. In many cases, restoring zinc is not just about hair. It improves immunity, growth, skin health, appetite, and overall resilience. Hair regrowth becomes a visible sign that the child's body is finally getting what it needs. When it comes to using zinc to support hair regrowth in children, safety is everything. This is where many parents feel confused, because they hear that zinc is essential for hair, but they're also warned that supplements can be harmful if used incorrectly. Both statements are true, and understanding the balance is what makes all the difference. The first thing to understand is that children are not small adults. Their bodies are growing rapidly, their organs are still developing, and their nutrient needs change with age. Because of this, zinc strategies that may be appropriate for adults can be completely inappropriate for children. Safe, age-appropriate zinc use focuses on meeting the body's needs, not pushing it beyond them. The safest and most effective starting point is always food. Food-based zinc comes packaged with other nutrients that improve absorption and reduce the risk of imbalance. When zinc is consumed from whole foods, the body naturally regulates how much it absorbs and how much it excretes. This built-in safety mechanism is one of the reasons food should always come first. For children, some of the best zinc-rich foods include eggs, yogurt, cheese, chicken, fish, lentils, chickpeas, pumpkin seeds, sesame seeds, and well-cooked beans. These foods not only provide zinc but also supply protein, healthy fats, and other minerals that support hair follicle health. Even modest improvements in diet can significantly improve zinc status over time. One common mistake parents make is assuming that fortified foods provide enough zinc. While some cereals and snacks are fortified, the zinc in these products is often poorly absorbed. These foods also tend to be high in sugar and refined carbohydrates, which can interfere with mineral absorption and contribute to inflammation. Relying on fortified foods alone is rarely sufficient for correcting a deficiency. Another important factor is preparation. How food is prepared affects zinc absorption. Soaking, sprouting, or fermenting grains and legumes reduces phytates, which are compounds that bind zinc and block absorption. While this may sound complicated, even simple changes, like soaking lentils before cooking or choosing fermented foods like yogurt, can improve zinc availability. Now let's talk about supplementation, because in some cases, food alone may not be enough. Children with picky eating habits, digestive issues, rapid growth spurts, or existing deficiencies may benefit from short-term zinc supplementation. The key word here is short-term and appropriate. Gentle forms of zinc are best for children. Zinc gluconate and zinc citrate are commonly used because they are better absorbed and easier on the stomach. These forms allow the body to utilize zinc efficiently without overwhelming the digestive system. Zinc oxide, despite being inexpensive and common, is poorly absorbed and not ideal for children. Dosage is where parents must be especially careful. Children require much smaller amounts of zinc than adults. Giving adult doses to a child can quickly lead to excess. Too much zinc can cause nausea, vomiting, abdominal pain, and long-term mineral imbalances, particularly with copper. The goal is to correct deficiency, not to flood the system. Timing also matters. Zinc should be taken with food to reduce stomach irritation, especially in younger children. However, zinc should not be taken at the same time as iron or calcium supplements, as these minerals compete for absorption. Spacing them out improves effectiveness and reduces waste. Liquid or chewable zinc supplements are often better tolerated by children who have difficulty swallowing pills. However, parents should be mindful of added sugars, artificial colors, and flavors in these products. Clean formulations with minimal additives are always preferable. One of the biggest misconceptions is that faster results require higher doses. Hair regrowth does not speed up with excess zinc. Hair follicles follow a natural growth cycle, and this cycle cannot be faux RCD. What zinc does is remove a barrier. Once the deficiency is corrected, the body resumes normal hair growth at its own pace. Parents should also understand that zinc supplementation should not be indefinite unless guided by a healthcare professional. Long-term supplementation without monitoring can lead to copper deficiency, which can ironically cause hair loss and immune problems. This is why food-based strategies and periodic reassessment are so important. Another overlooked aspect of safe zinc use is gut health. Zinc absorption depends heavily on a healthy digestive system. Children with chronic digestive issues may not absorb zinc efficiently even from supplements. Supporting gut health through balanced meals, adequate fiber, fermented foods, and reduced processed foods often improves zinc status without increasing dosage. Stress management also plays a role in how zinc is used by the body. Emotional stress increases zinc requirements and can slow hair regrowth. Children experiencing school pressure, sleep deprivation, or emotional challenges may need extra support beyond nutrition alone. Adequate sleep, routine, and emotional security help the body utilize zinc more effectively. Hydration is another small but important factor. Proper hydration supports circulation and nutrient delivery to the scalp. While it won't fix zinc deficiency on its own, dehydration can slow overall recovery and hair regrowth. It's also essential to set realistic expectations. Hair regrowth in children takes time. Parents may notice reduced shedding first, followed by the appearance of fine new hairs. These new hairs may look lighter or thinner initially. Over time, as the follicles strengthen, hair thickness and density improve. Parents should resist the urge to constantly switch supplements or add multiple products at once. This makes it difficult to know what's working and increases the risk of imbalance. Simplicity and consistency are far more effective. Another important safety point is combining zinc with a balanced intake of other nutrients. Zinc works in harmony with protein, iron, vitamin A, and essential fatty acids. A child who lacks protein, for example, will not regrow hair efficiently even if zinc levels are corrected. This is why a whole food approach is always superior to isolated supplementation. Parents often ask how long it takes to see results. In most cases, reduced shedding can be seen within several weeks, while visible regrowth may take 2 to 3 months or longer. This timeline reflects normal hair biology, not a lack of effectiveness. The emotional side of hair loss should not be overlooked. Children may feel self-conscious or anxious about changes in their hair. Parents who approach zinc strategies calmly and positively help reduce stress, which indirectly supports better outcomes. Safe zinc strategies are not about fear or overcorrection. They're about understanding the body's needs and meeting them gently. When zinc is provided in the right form at the right dose and within the context of a nourishing diet, it becomes a powerful ally in restoring healthy hair growth. Perhaps the most reassuring thing for parents is this. When zinc deficiency is addressed safely and appropriately, children's bodies often respond beautifully. Hair regrowth becomes a visible sign that the body is healing, balancing, and thriving. In the end, zinc is not a magic pill. It's a foundational nutrient. Used wisely, it supports not just hair regrowth, but immune strength, growth, focus, and overall vitality. That's why safe, age-appropriate zinc strategies matter so much when it comes to pediatric hair loss. One of the most reassuring truths for parents dealing with childhood hair loss is that in most cases, it is reversible. Pediatric hair loss is rarely permanent, and when the underlying causes are identified and corrected, the body often restores healthy hair growth on its own. Understanding this can completely change how parents respond, shifting from fear and panic to calm, focused action. Hair loss in children is usually a signal, not a disease by itself. It's the body communicating that something is out of balance. That imbalance may involve nutrition, stress, illness, digestion, or lifestyle factors. Once those issues are addressed, hair follicles, which are remarkably resilient in children, can recover and return to their normal growth cycle. One reason pediatric hair loss is so often reversible is because children's hair follicles are still highly active. Unlike adults whose follicles may gradually shrink over time due to hormonal changes, children's follicles are designed for growth. When the obstacle is removed, whether it's zinc deficiency, poor nutrition, or excessive stress, the follicles are capable of restarting growth. Nutrition is one of the most common factors involved. Children need a steady supply of nutrients to support growth. When their diet lacks key building blocks like zinc, protein, iron, or healthy fats, the body makes survival-based decisions. Hair growth is paused so that energy and nutrients can be redirected toward vital functions like immune defense and brain development. This is not damage, it's a protective response. Once nutrition improves, the body no longer needs to conserve resources in this way. Hair follicles gradually re-enter the growth phase. This process doesn't happen overnight, but it does happen consistently when the child's nutritional needs are met. Stress is another powerful but often underestimated factor. Emotional stress, school pressure, lack of sleep, family changes, illness, or even rapid growth spurts can push hair follicles into a resting phase. This type of hair loss, often referred to as stress-related shedding, is very common in children. The encouraging part is that stress-related hair loss is almost always temporary. When stress levels decrease and the child's routine stabilizes, hair growth typically resumes. Zinc plays a supportive role here, as it helps regulate stress hormones and supports nervous system function. By addressing both nutrition and emotional well-being, parents create an environment where hair regrowth becomes possible. Gut health is another critical piece of the puzzle. A child can eat a nutritious diet and still experience hair loss if digestion and absorption are impaired. Frequent digestive issues, food sensitivities, or repeated antibiotic use can reduce nutrient absorption. When the gut heals, nutrient uptake improves, and hair follicles receive the support they need. Correcting gut health often leads to improvements beyond hair. Parents may notice better appetite, improved energy, fewer infections, and more stable moods. Hair regrowth becomes one of several signs that the body is returning to balance. Illness can also trigger temporary hair loss in children. Fevers, infections, and inflammatory conditions increase the body's demand for nutrients, including zinc. During illness, the immune system takes priority, and hair growth may temporarily stop. Weeks or months later, shedding becomes noticeable. This delayed response often confuses parents. The key point here is that illness-related hair loss usually resolves on its own once recovery is complete and nutrient stores are replenished. Supporting the body during and after illness speeds this process and reduces the duration of shedding. Another reason pediatric hair loss is often reversible is that children typically have not experienced long-term follicle damage. In adults, years of hormonal imbalance, inflammation, or nutritional deficiencies can lead to structural changes in hair follicles. In children, these stressors are usually short-term. Once corrected, follicles can resume normal function. Parents should also understand that hair regrowth follows a predictable pattern. The first sign of recovery is usually reduced shedding. This may happen before any visible regrowth occurs. Next, fine, soft hairs may appear, especially along the hairline or in thinning areas. These hairs gradually thicken over time. Patience is essential during this phase. Constantly checking the scalp or switching strategies too quickly can increase anxiety without improving results. The body needs time to complete each stage of the hair cycle. Another important factor in reversibility is addressing multiple causes at once. Pediatric hair loss is rarely due to a single issue. Nutrition, stress, sleep, hydration, and gut health all interact. When parents focus on the whole child rather than just the hair, results are more consistent and long-lasting. Sleep, for example, plays a major role in growth and repair. Growth hormone, which supports tissue regeneration including hair follicles, is primarily released during deep sleep. Children who do not get adequate or quality sleep may experience slower recovery from hair loss. Improving sleep routines often leads to noticeable improvements in hair health. Hydration supports circulation, which helps deliver nutrients to the scalp. While hydration alone won't fix hair loss, dehydration can slow recovery. Encouraging regular water intake supports overall healing. Emotional reassurance is also critical. Children are perceptive and may become anxious if they sense parental worry. Anxiety can increase stress hormones, which further disrupt hair growth. When parents remain calm and supportive, children feel safe and the body responds more favorably. It's also important to recognize when hair loss may require medical evaluation. While most pediatric hair loss is reversible, conditions like fungal scalp infections, autoimmune-related hair loss, or habitual hair pulling need specific interventions. Addressing these conditions early improves the likelihood of full recovery. Zinc plays a central role in reversibility because it supports so many systems at once. It aids cell division, immune balance, stress response, and scalp health. When zinc levels are restored safely, the body regains the ability to prioritize growth, including hair growth. Parents should avoid comparing their child's progress to others. Each child's timeline is unique. Factors like age, severity of deficiency, overall health, and stress levels all influence recovery speed. What matters is consistent improvement, not instant results. Another encouraging aspect is that children often respond faster than adults. Their bodies are designed for growth and repair. When given the right support, recovery tends to be efficient and complete. Education empowers parents. When parents understand that pediatric hair loss is usually a temporary response to imbalance, they can make informed decisions rather than reacting out of fear. This mindset leads to better outcomes and a healthier family dynamic. Hair regrowth is not just cosmetic, it's a reflection of internal balance. When hair returns, it often signals improved immunity, better digestion, more stable energy, and overall well-being. In the end, the message for parents is hopeful. Pediatric hair loss, especially when linked to nutrition, stress, and gut health, is usually reversible. The body is not broken, it is adapting and protecting itself. When you identify and correct the underlying causes, the body remembers how to grow. By focusing on safe zinc strategies, balanced nutrition, emotional support, and healthy routines, parents can help restore not just their child's hair, but their confidence and health as well. Hair regrowth becomes a visible reminder of the body's incredible ability to heal when given the right tools and time.